welcome to the doctor and the late clinic. So, what brings you to the doctor today? It's been overdue for a checkup, okay. Well, we can provide that. Thank you for coming to the late clinic. We've had a lot of interest and it's been quite busy, so. Alright, let me see here. Let me bring up a file. Okay, first and last name. Okay, and birthday. Okay. Let's see here. So, alright, it has been quite a while since you've been in. What's been going on? Tell me about how you've been, how's your health been, just give me the general kind of overview. You think you've been fairly healthy, okay. How about any family changes? Okay, yeah, any sort of new chronic illnesses, cancers, things like that? Okay. Not that you're aware of. Good. That's a relief. Okay. How about personal hospitalizations, illnesses, anything, any recent surgeries? Couple of bouts in the ER. Okay. Nothing serious, okay. Let me just take a peek here and check out what those visits were for, okay? Okay, so it does look like a couple of flus and sore throats. You were positive for strep, so not too long ago it looks like. How are you doing now? Throat's feeling all better, okay. You completed your antibiotics? Good. Okay. Perfect. Alright, so nothing terribly significant. No surgeries, correct? Okay, good. Alright, how about any family changes personally? Married, children, anything like that? Okay. 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 Oops, hold on. Let me get to the right screen. Okay. Alright, so really nothing terribly new. How about you just now? Mental health doing okay? Okay. Alright, well, if there's any changes, I would be more than happy to send a referral. Okay? Sure. Seem like you're doing okay, though. Perfect. Okay. Alright, and then how about any health changes for you? Any new moles, any sort of pain or, issues that you do not feel are normal for you? Okay. Sure. Okay. Well, I can definitely take a look at them here. You have how many moles? 3. Okay. Are any of them new? Just older ones, okay. And have there been any changes? One of them, okay. That's fine. And then you said your ears are feeling a little clogged, okay. How's your hearing been? You feel like that's getting worse or staying about the same? Okay. So you feel like certain pitches are a little hard? Okay. Alright, how about your vision? Yep, as we get older, there's usually some changes. Yeah. doing okay there. Okay, well, I think we'll set about doing just a normal physical exam, and then we'll see what we can find. Okay, perfect. During the exam, I'll be getting a little close to you. There will be a little bit of touching. Is that okay? Okay, good. Okay, let's put that over there. Alright, just grab some hand sanitizer here. Clean my hands, make sure everything is good, okay? Okay, and I'll grab a fresh pair of gloves. Okay, we have okay. So first thing I think we're gonna do is just take a small set of vitals, okay? Listen to your heart, your lungs, blood pressure, pulse, temperature, okay? Alright, let's see here. Okay, I'm just coming a little bit closer to you, okay? Good. Alright, just take a nice deep breath for me, okay? Breathe in through the nose and out through the mouth. Good. And again, breathe deeply all the way into the lungs. And exhale. Good. Perfect. Alright, other side here. Okay, take a deep breath for me into the mouth and out of the mouth. Good. And again, big breath into the mouth and out of the mouth. Good. Make sure you're exhaling completely, okay? Completely. And one more time here, okay, on this side. Big breath. Big breath. Okay. And I'm just gonna reach behind you here. And we're gonna do the back. Good. Good. Okay. And the other side. Good. Good. Perfect. Alright, great job. Heart and lungs sound great, okay? Okay, I'm gonna just touch right on the inside of the wrist. Is that alright? Okay, good. Okay, just gonna take a peek at my watch here. Good. Doing well. Just relax. Make sure your legs are not crossed. Okay, good. Alright, and also I did get your respirations as well. Just get those down real quick. Okay. Perfect there. Just gonna grab a quick temperature. Okay, you ready? Just stare straight forward, okay? And all the way across, good, and back. Oh, hold on a sec. let's try that one more time, okay? Here we go. And across and back. Good. Perfect. Textbook. You're making my job very easy today. Okay. Alright, let's take a look at your eyes, okay? I have an otoscope here. I'm just going to use the tip of it with the light to look into your eyes, okay? I'll just have you follow some very simple instructions and it'll be very easy, okay? Alright, let me grab a fresh tip. Okay, here we go. There's the light right there, okay? So I just want you to follow it. Okay. Keep your eyes right here on my nose. Good. Perfect. Right across. Breathe normally and naturally. Okay. Just keep looking right at my nose. Perfect. Perfect. Good. Great. Great. And now just move your eyes with the light. Move your eyes with the light. Good. Perfect. And maybe the other side, okay? Just keep watching it. Moving only your eyes. Moving only your eyes. Okay, good. Excellent. Now again, just stare right into the center, okay? Good. Just gonna bring it into the side. Check your pupil reaction, okay? Right into the side. Good. Okay, and again. Good. And again. Good. And one more time for good measure, okay? Perfect. Perfect. And perfect. Alright. I'm just gonna have you stare straight forward, and I want you to tell me when the light comes into your peripheral vision, okay? Good. Here we go. Just tell me when you can see it. Good. Okay. And again. Good. Okay. And again. Good. Perfect. Good. No pressure here, okay? And when do you see it? Good. Very good. Okay. So I have a little light chart here, okay? Alright, so we're just gonna start kind of at the top, work our way down, okay? What's this one? N-E, perfect. This one? An L, perfect. A T. An F. That one? A P, perfect. this one? Nothing, huh? Okay. And L, good job. Nothing on that one, okay? That was a C. And nothing, okay. That's okay. Nothing to worry about. What color is this? Red, good. And this side, green. Perfect. Okay. When was the last time that you had your eyes checked? It's been a little while, okay? I know sometimes life can really catch up with you, and suddenly it's been a long time since you've had some of those things done. So, you've done a great job coming to the doctor and, being here, but also I would recommend making a visit to the eye doctor. And, how about the dentist? You've been there recently? A very long time. Okay, well, definitely do that. Some of the cleaning they do is a little difficult to do at home, okay? You want to make sure all that buildup's gone and your teeth are healthy. That can really affect your overall health, okay? Alright, so, nothing too concerning about your eyes today. I'm going to let you talk to the eye doctor, but, maybe a pair of reading glasses might not hurt for you, okay? Okay, good. Okay, just a couple of simple things and then we'll take a peek at your ears, okay? Okay. So I'm gonna just push down on your shoulders. Don't let me. Good, perfect. I want you to just puff out the cheeks for me. Okay, puff out the cheek. Good, okay. Raise your eyebrows. Perfect, okay. And I just kind of want you to make like a scrunchy face, okay? Perfect, alright. And then hold your hands out here. I'm going to try to lift them from underneath, and I want you to push against me, okay? Push. Good. Okay, perfect. Alright. Got a little reflex hammer here. You are sitting on the table and your legs are dangling, so I'm just gonna catch that reflex real quick, okay? Good. Okay. Perfect. Good. Perfect. Get your elbow here. Perfect. Okay, just gonna get your pulses here, okay? That's better. Good. Okay. Alright, I'm gonna grab another fresh tip here, okay? And we're gonna take a peek at your ears. So, let me just turn my light on, okay? Good. Oh dear, okay, we've got quite a bit of buildup in here. Okay, yeah, occluding the eardrum. I'm just gonna tug a little bit, just on the earlobe, kind of bring it back a little bit. Just helps me see a little bit into the ear canal, okay? Good. If there's at all any pain, just let me know. Okay, just gonna pull that back just a little bit. Okay, good. Okay, gonna need some cleaning on that side. Taking a peek there. On this side as well. Okay, not as bad as the other side. Not fully occluded, but just a little bit. Just a little bit, okay. I'll need to take care of both sides. Recommend cleaning regularly. A little impactation going on. Okay, so your ears are definitely a little red. A little inflamed inside, and it might be due to a lot of earwax buildup. This side is completely occluding the eardrum, so I imagine you're maybe having a little trouble hearing. Maybe a little ringing in the ears. And then this side, not as bad, but still gonna use a cleaning. Is that okay if we take care of that? Okay, it won't take long. Let me grab a couple things here. Okay. So what I'm going to do is just put some drops in your ear, okay? A couple in each side. We're gonna let that sit for just a second, and then we'll just scrape a little bit away, okay? Till you're nice and clean. And then we're gonna irrigate, okay? Okay, go ahead and tilt your ear. Perfect. And now the other side. Okay. Now let those kind of sit for a little bit. Let me take a peek at those moles while those are sitting, okay? Alright, where are they? The one on the face here, okay? Just grab my little measuring tape here, okay? Okay, really not terribly concerning. Okay, good. It's not very big. Okay. No, I think this pattern is okay. How long have you had this one? Your whole life, okay. Usually the moles that you start out with or have from a very young age are not quite as concerning, especially if you're not noticing any changes, okay? That being said, do make sure you're vigilant to keep an eye on it, but I don't think there's any trouble with that one, okay? And then you have one on your arm, okay? And how long have you had this one? This one's new, okay. When you say new, what do you mean? Within the last year, okay. Since you first noticed its appearance, has it changed at all? No, okay. It does look slightly different than your other moles though, okay? And I am a big proponent of better safe than sorry, okay? So what I'm gonna do is I'm going to give you a referral to the dermatologist, okay? And I want you to take it seriously. Please go in and just have them take a look at it, okay? If they want to remove it, they might have a little biopsy and just get it checked out, okay? To make sure none of those cells are something you should be worried about. From my eye, I think it's fine, but I do think that we should get it checked out, okay? I'm always very cautious when you have something that's new that pops up, so, correct. Okay, let's take a look at those ears, okay? I have a couple of ear cleaning tools that I will use to clean the ear, okay? So, this shouldn't hurt, but I will be putting a large amount of saline through your ear, and there will be a little bit of scraping, okay? Okay, here we go. is all cleaned out over here. Okay, good. Just take a quick peek. Perfect. Alright, let's do the other side. This one wasn't as bad, okay? So we're gonna do Alright, those are looking much better, but I'm gonna recommend that maybe you go to an ear cleaner maybe once a year. And then also try not to use ear like Q-tips inside the ear canal. Sometimes those can push the earwax just further into the ear and can create some impactation right against the eardrum, can lead to some symptoms. Sure, okay. Alright. Is there anything else that I can help you with today? Okay. I would say overall you're doing very well. Okay, nothing terribly concerning today. Just want to write your prescription, I think. This is going to be for some eardrops. Okay. Those eardrops will help with any inflammation, okay? And then I'm also, just sit tight real quick. Just gonna send a referral out, okay? This will be to dermatology. Okay. Perfect. And then also, would you be receptive to doing some lab work? It's been so long since you've been in that it's good to have a new baseline for you. Okay, good. I'm gonna put in for a lab draw. You can head right out to the lab station. After this, they do take walk-ins. Shouldn't take more than about 15-20 minutes. Just put in some metabolic panel, complete blood count, and probably a TSH, I think. Okay, perfect. Okay. Alright. Well, if there's nothing else, I'll let you get on with your evening, and we'll see you next time, okay? Good night. Morika ASMR.